right. Good morning, good evening, good afternoon. Hey, everybody. We're going to get started here in just a minute. It's Dr. Eric Naputi. Welcome to our Wednesday night wellness workshops. Man, I'm super excited to be with you all tonight. Got a great topic for everybody. It's almost top of the hour. We'll give everybody a chance to chime in and see let me know where y'all are watching from. Where's everybody at? I'll put the chat up here so I can see. Where's everybody watching from? California's in the house. Hey, Robin, good to see you. Hey, Jeannie, how are you doing? Hey, Kevin, how are you doing? Awesome. So good to see you guys. Right on. Texas, North Carolina, Costa Rica's in the house, California, New York, New York. I'm going to be at an event. I'm speaking at an event in Charlotte at the end of next month as well. I have to let you guys know where that's at so that you can check us out there as well. All right. Just another minute. We'll get started here in just a second. Yeah, it's great to see you guys. Where else? We got some of our Canadian friends are here. We got Malaysia's in the house. We've got Iowa, Texas, Alberta, California, Las Vegas, Tennessee. What's up, Drake? Good to see you, man. Kevin, how are you? Rich, how are you? Man, it's so good to see you guys. Australia's in the house tonight, today, tomorrow. Bermuda's here. Oregon, Indiana, all over the globe, baby. It's so good. All right, well, I got top of the hour, so here we go. We're going to get into this thing. Hello, Tokyo. It's good to see you in Japan as well. Looking forward to being in Japan with y'all very soon as well. Okay, so hey, everybody, it's Dr. Eric Naputi. It's our Wednesday night wellness workshop. Really excited to be with you tonight because tonight is one of my favorite topics. And I'm going to tell you, it is probably one of the most important topics that we will cover. So remember how our Wednesday night workshops go. I'm going to speak, I'm going to lecture, I'm going to educate you and entertain for just about 30 minutes or so. And then I'm going to open for Q&A. We're going to talk about health. We're going to talk about wellness. We're going to talk about all things health and wellness tonight. But tonight's topic is really near and dear to my heart and really near and dear to most of y'all's hearts as well. We're talking about gut health and how the gut is the root of all problems. I don't know if you saw this, but behind me right here, I've got this amazing statue of Hippocrates, right? Hippocrates, the father of medicine, said, heal the gut and all other things will fall into place. Well, what do they mean by that? Well, the gut is a lot of times the root of all problems that are out there. So listen, let's get into this thing. I've got some notes that I prepared for everyone. I'm going to kind of just really lay it on you pretty heavy, but I'll promise you, if you'll understand this, if you'll pay attention to this and then go back and re-listen to this again and take some notes on this, this information can and will change your life and change your life forever. There's zero question in my mind about that. There's zero question because I know that this information has already changed the lives of millions and millions of people across the globe. So let's talk a little bit about gut issues, about leaky gut, about the symptoms that leaky gut cause. I'm telling you, this is, if you have these problems with leaky gut, I'm going to show you some simple ways to test for it. We're going to give you some of my favorite biohacks to deal with it. But if the gut's not right, then cardiovascular function is going to be bad. Immune system function is going to be bad. Brain and neurocognitive function is going to be bad. Your body cannot produce energy like it's supposed to. You're going to have more respiratory problems. You're going to have issues with hormonal stuff. You're going to have problems losing weight and metabolism is going to be down. The gut really is the key to everything. And when I talk about GI problems, I don't just talk about, that Pepto-Bismol commercial, right? Diarrhea, constipation, upset stomach, all those things. Those things do fall into place with it, but digestive imbalances and something known as digestive leukocytosis is one of the most, it's one of the most common problems that we find, that we have globally. And I'm going to tell you this, according to the data and research, this is why this topic is so important. According to the data and research, 95% of the world that is eating the standard American diet or Western type foods has some form of leaky gut. And there's a spectrum of this, right? There's everything from, inflammatory bowel problems, Crohn's, colitis, all that, all the way to, heartburn, indigestion, and everything from sore, stiff joints, headaches, migraines, fatigue, anxiety, depression, mood swings, obesity, vision issues, skin problems. I mean, the gut is the key. There's a reason why I talk about there's a core four of things that we need to measure for health. You need to know how your central nervous system, your brain and spinal cord are functioning. You need to know how your DNA is functioning and are you living for your DNA lifestyle? You need to know what your gut microbiome is functioning like, and you need to know your cellular function, toxicities, and deficiencies. We can take all these complex health and wellness topics, these complex, like, crazy symptoms. And by the way, at the end of this, I promise you, what you're going to ask me, all of you are going to ask me so many questions about your symptoms, and I'll answer them. But I'll tell you and I'll promise you that if you have issues with the GI tract, you're going to have problems with whatever it is. I don't care if it's cancers, if it's heart disease, if it's diabetes, if it's strokes, if it's heartburn, indigestion, if it's mood swings, you name it. If the gut is off, it's going to be very difficult, if not impossible, to try to relieve the symptoms of all those other problems. Okay. So, a couple things I wanted to talk about here. Number one, did you know that approximately 90% of the immune system, 90% of the immune system lives in the gut? Just so you know, it's called the gut associated lymphatic tissue, the GALT. And that is the immune system. That's where the immune system really is housed. So if the GI tract is off, and I'm going to show you some ways to measure that in just a moment, but your immune system can't work. And then there's something called the brain gut connection. And there's a nerve that connects the two of those called the vagus nerve. And the vagus nerve and the brain gut connection are responsible for your body's ability to rest, relax, grow, develop, heal, and make immune function, and its digestion as well. So if you have a leaky gut, you're going to have a leaky brain. Studies have proven again and again and again that if we take healthy gut bacteria, put it into a human being that does not have healthy gut bacteria, their immune system goes up, their inflammation goes down, their pain goes down, their anxiety, depression, and insomnia can go down, and they are healthier all in all. So I need you to understand how powerful and impactful the gut is. And I want you to also understand from a metabolic standpoint, there are certain bacteria. And I want you to understand this. There are bacteria in and on our body that we live symbiotically with. My wife showed me a TikTok video the other day, and it was a video of somebody taking an organic banana, a natural banana from a tree without pesticides, without herbicides, without larvicides, just a normal, just natural banana. They took a piece of that banana, they put it under a slide under the microscope and looked at it under the microscope. And there were all these bacteria and there were all these fungi and all this stuff that's on it. And people were saying, oh my gosh, I can't believe this food is dirty. No, that food is not dirty. That food has the microbiome, the bacteria that we're supposed to ingest, that we're supposed to be like it's in the soil that we're supposed to be exposed to, because that bacteria, if that bacteria is not in our body, our cells can't signal properly, our hormones can't produce properly, our neurotransmitters in our GI tract can't be produced. The neurotransmitters are the chemicals made in the GI tract that travel up through the vagus into the brain and tell our body to be happy, healthy. The serotonin is the happiness neurotransmitter, to be balanced and to be even. If we don't eat those healthy bacteria, if we're not playing out in the dirt, if we're not walking around outside barefoot, if we're not doing the things that we're naturally supposed to do, we don't get that bacteria. And if we don't have that bacteria, then our body can't break down foods, it can't digest it. If we don't have that bacteria, our body can't clean out all the other bad toxins. If we don't have that bacteria, we don't have the normal protective linings in our eyes, our nose, our mouth, our ears, and all of the holes in our body that are mucous membranes don't work proper. Now, there are so many interesting things also from a metabolic standpoint. Like I said, if you take healthy bacteria from one human being who's healthy, balanced, and has lean muscle mass, and you put that same bacteria in somebody who's overweight, who's inflamed, What happens is 9 out of 10 times that individual who was overweight, inflamed, will start to lose weight. They'll start to reduce their inflammation and their body will start working again. You see, we've been lied to by so many things. We've been misinformed by so many things. Some of the worst things that you can do is to have food that doesn't have bacteria in it. And so when you go and you shop at the grocery store, when you go, you should shop around the outside of the grocery store where the fresh produce and the meat and the eggs and the vegetables are kept. In the middle aisles is where all of the foods that have been enriched with well, unfortunately, synthetic nutrients and have been deprived of all of the good bacteria. So again, just to reiterate, the gut, the GI tract, the digestive system, and the enteropathic nervous system control your brain, control metabolism, control your hormones, control your blood sugar levels. They control your gut-brain axis. They control so many things in the body, and if it's out of whack, we're going to have problems. Now, I just got done speaking to a large group of doctors, literally an hour and a half before I got on this call. There were 130 doctors on this call, and we were talking about autoimmune conditions. And I showed them how most people who have autoimmune issues have underlying issues of leaky gut, dysbiosis, or dysbacteriosis. They've got GI problems that are causing them to have chronic inflammation. And that chronic inflammation is leading them to have the positive blood test of an ANA titer. Well, when the normal medical world, if you have an autoimmune issue, what do? First of all, they label you. And second of all, they give you a drug. And I will tell you, God bless my mother, God rest her soul, but she taught me many, many things. And one of the things she taught me was, number one, don't call people names. So I'm not saying you're an autoimmune patient, you've got lupus, you've got rheumatoid arthritis, all of those names for those autoimmune problems, Hashimoto's thyroiditis, type 1 diabetes, those are all autoimmune issues. So I don't call people names and I don't do drugs and I don't give them because it's not fixing the problem. But if we can get the gut fixed, we get the root cause of the problem fixed, then guess what happens? They get better. So here's some more symptoms. Here's some more symptoms of leaky gut or problems with the GI tract. If any of you have any of these symptoms, give me a thumbs up, or if you know anybody. Number one, any type of gastrointestinal issue, bloatiness, gas, distension, diarrhea, constipation. By the way, I was talking to my daughter, my 11-year-old last night, and she says, Dad, what's the definition of constipation? If you're not having at least one bowel movement a day, you're constipated. What's the definition of diarrhea? If you're having more than 3 bowel movements a day, that could be considered excessive bowel movements. So we need to be between 1 and 3 solid bowel movements. And just, we're all adults here. And this is what I tell my patients and what I tell other doctors is when you go to the bathroom, your fecal matter should be, well, one of my good mentors told me that we should have something called a 2-foot floater, which means that we should have a cylinder type bowel movement that floats, right? We don't want to have all these other things. And maybe some other time I'll talk to you about fecal matter and different shapes and different sizes and different colors of it and what that means in the body. So any type of GI problem, if you get fatigued after you eat a meal, if you get bloatiness, gas, reflux, heartburn, indigestion, any of that stuff, if you have any type of food sensitivity or intolerance, 90%, at least my clinical experience the last 20 years, 90% of anyone who has any type of food sensitivity, food allergy, something of that nature, especially if it's a real food. When I say real food, I'm talking about fruits, vegetables, meats, eggs, butters, that kind of stuff. I'm not talking about, synthetic stuff. I'm talking about real food. If you have a sensitivity to real food, then you most likely have a problem with leaky gut or gut bacteria issues. Any type of neurological symptoms, like, I don't know if you saw this, but just recently, a famous football player just announced that he has Parkinson's syndrome. Well, I don't know if you know this, but Parkinson's syndrome a lot of times can happen after post injuries to the brain. Did you know that when you have a concussion, that can cause a negative reflex arc back into the GI tract? That's right. If you've had head injuries or whiplashes where your neck is whipped and you've injured the vagus nerve, that could cause a negative feedback loop into your what's called enteropathic nervous system, into the GI tract, which can cause you to have problems with digestion. So you could have there's all kinds of reasons why you could have the symptoms you have. That's why in my world, we don't guess, we test and we find out why. Also, any type of depression, anxiety, insomnia, any of those things, the first thing you have to do, you must check the gut. You must check the gut. Current research shows there was a study that was done, University of Minnesota, that showed that 86%, listen to this, 86%, remember that number, when folks changed their diet, got the right bacteria, took the right micronutrients, they had an 86% improvement of their depression, anxiety. The symptoms that they had were better than when they took their medications for the drugs to fix that. Now, I'm not telling you to go throw your drugs away, but what I'm telling you is you may have an imbalance in your body that's causing those symptoms, and it's not because you have a Prilosec deficiency or a Prozac deficiency or a Tylenol deficiency. You have to get to the root cause of the problem. Look, I don't know if you know this, but high doses of antibiotics, which are in our system all the time, high dose use of antibiotics can cause us to have depressive states. Now, I don't know, again, if you know this, but there are three major reasons why we get leaky gut or gut problems. Number one is the standard American diet. Eating processed foods, eating too many synthetic foods, having foods that have, glyphosate, Roundup on it, things of that nature. I mean, those things literally poke holes in our digestive tract, literally poke holes in it. Number two, if you are under stress, physical, chemical, or emotional stress, we know that stress causes inflammation. That stress causes an increase in cortisol. That cortisol and inflammation can poke holes in our digestive tract and poke holes in our brain. The tissues can literally look like Swiss cheese when you're under chronic stress. That's why when people get stressed out, what's the response of stress? They go hand here and a hand here, or they go like this, or they go, right? Because that's the reflex for stress. That's where stress manifests and hits first in our body. So I think it's really important that you understand that, especially the fact that if you're under chronic stress and it affects the gut, one of the first things that's going to go south are your neurotransmitters. And that can cause all kinds of issues. By the way, things like neurological demyelinization, Parkinson's, dementias, Alzheimer's, we find a decrease in neurotransmitters like GABA and dopamine, and sometimes serotonin. Well, those are all made in the gut. So if you have those neurological issues, we must first check the gut to make sure there's nothing else out of balance that's going to hinder the brain from healing. So we talked about the standard American diet being an issue. We talked about being under stress being an issue. And stress is more than just emotional. Stress can be physical. You could have had an injury. You could be overweight, underweight. You could sit too much, stand too much. There's all kinds of physical stresses in the body. And then there's chemical stresses where the body's either deficient or it's toxic in something. And that's it. That's all it can be. It can either be deficient or toxic. That's it. And those three things are the main leading causes of gut issues. Now, I'm going to talk to you a little bit about the use of antibiotics. Now, we have a massive overprescription of antibiotics, and we have since the beginning of antibiotics. Now we have antibiotic-resistant bacteria, where bacteria do not respond to the antibiotics that they used to give you. Did you know that if you take one dose of antibiotics, which is typically a 5 to 7 day run of antibiotics, a Z-Pack or something like that, that could actually disrupt the normal healthy bacteria in your GI tract for between 12 to 18 months. That's one dose of antibiotics. Did you know that the average American gets 3 rounds of antibiotics per year? No wonder we're fat, sick, and nearly dead. No wonder we're so inflamed. No wonder we have so much depression, anxiety, and all these things. And mark my words, we are seeing a massive ramp up of mental health happening globally, but especially here in North America. And I'm telling you that there's a vast majority, a big, huge percentage of those that are having those problems because their gut bacteria is completely out of whack. And by the way, that's exactly what the research tells us. That's what the science tells us. So if somebody tells you that that's not true, that somebody doesn't know what they're talking about. Go find someone who does. So those are the main things. Here's some other symptoms: brain fog, difficulty concentrating, memory issues, physical imbalance where you feel like, you're off balance. You've lost your equilibrium. Your stress response is no good. Little things set you off. When you get mad all the time. Like that could be a sign of gut bacteria being off. By the way, cortisol levels, the stress hormone, when bacteria is off, it throws the adrenals off, and that could be the original cause of adrenal fatigue syndrome in so many people. Look, as a functional medicine practitioner, I've literally pulled the rest of my hair out when I hear people talk about treating adrenal fatigue syndrome. I'm telling you that treating adrenal fatigue syndrome is like putting a piece of tape over the check engine light of your car. What we really need to do is treat the cause of the adrenal fatigue syndrome, which is, by the way, most likely gut bacterial issues. And oh, by the way, did you know that most men and a lot of women lose their hair because they get fungus built up into the skin and the pores of their head? I don't know if you know that or not, but that's because there's an abnormal bacteria. Urinary tract infections, vaginosis, rectal issues, chronic ear infections. If you stick your tongue out and your tongue's white, that's a yeast overgrowth, yeast infections, fungus in your toenails, uh, chronic sinusitis. Those are all imbalances of normal bacteria. It's an overgrowth of bad bacteria, and we need to fix that. We got to destroy the bad bacteria, which is step one. And I'll show you how to do that in a minute. But step number two is we got to fill it back up with the right stuff. I think it's important also to note that metabolic issues, obesity, type 2 diabetes, metabolic syndrome is when you have low HDL, high LDL cholesterol, high total cholesterol, you got insulin resistance or diabetes, so your blood sugar levels are high, and you have high blood pressure. Those are all signs of metabolic syndrome. Cardiovascular disease, that's a sign of gut issues as well. Skin conditions, eczema, psoriasis, hormone imbalances, fatigue, poor nutritional absorption, which so many people have. Let me explain something. Think about your intestinal tract like a tube. When we eat food, it goes down our tube, down our digestive esophagus, into the stomach. From the stomach, it goes into the small intestine. The small intestine is where absorption and digestion breakdown happens. Now, if you have the standard American diet, if you have too much stress, and if you have chemical deficiencies and toxicities and a lot of antibiotics in your system, which by the way, you may not get them from taking antibiotics, you might get it from the water. If you drink water that's not filtered, you're drinking antibiotic riddled water. Our septic systems cannot filter out hormones, and they can't filter out antibiotics properly. And it's in a lot of chicken, beef, and pork. They inject that stuff. Farmers learned that if they injected their animals with antibiotics, that it destroys the bacteria in the gut and it makes the animals fatter, which makes them weigh more. So then when they go to the market to sell them, they have more of a product to sell. So we've got poor absorption. So think about it. It goes through here into the small intestine. The small intestine is like a tube. Think about it like a garden hose, right? Well, nutrients come down, and then what happens is there's these little finger-like things called cilia. And these cilia are where the nutrients absorb. And then the toxins move on. They go in the large intestine and they come out in the fecal matter, right? Well, there's so many toxins in your digestive tract. You have enough toxins. You watching me right now have enough toxins in your GI tract to kill everybody probably on this Zoom right now, everybody that's watching. That's how toxic your bowel is. That's why if you have something like an appendix rupture, you have to get that surgery and cleaned out immediately, or you'll get sepsis. Sepsis is when we get infections in the bloodstream. If we get infections in the bloodstream, the blood's going to carry those infections and that inflammation to all the organs of our body and even to our brain. It'll pass the blood-brain barrier. Well, there's a 60% fatality rate with sepsis. That's a mega load of toxins getting in your body when the appendix ruptures. Now, what happens is if you have leaky gut, now that tube, that garden hose, somebody poked it with a bunch of little needles, and now there's these tiny little leaks in it. And these little bitty leaks are allowing two things to leak out. Number one, the nutrients that you're supposed to be absorbing through those little finger-like cilia, that's leaking out. So that's kind of like if I took gas and put gasoline in your car and that gasoline slowly leaked out. Well, that gas doesn't get to your engine. Now the car doesn't run. Well, think about how does that equate to you? If I'm eating food, which is fuel for my body, and it leaks out of my intestinal tract, well, guess what? I'm going to be fatigued. And when I'm fatigued, that's a whole domino cascade that we don't want to be dealing with. What's the other thing that leaks out? Now I've got these little micro holes in the tubes in my intestinal tract. Now what happens? Now those toxins are going to leak into my bloodstream. Now I'm getting little bitty micro doses of sepsis over a long period of time. Well, that doesn't kill me in 24 to 48 hours, but it shortens my life, and it causes inflammatory conditions systemically, which causes a systemic autoimmune response, which is known as dysautonomia, which you and I commonly refer to as an autoimmune disease. That's how simple that comes together. So this whole leaky gut bacteria thing, it's a really big deal. It's not difficult to fix, but the longer you go, the more problems you have. That's why when the gut goes bad, next thing that goes bad is going to be the endocrine system. That's your thyroid, that's your hormones, that's your metabolism. Well, now you're going to see the doctor because your testosterone's low, or you're going to see the doctor because your thyroid's not working. And all they're doing is managing your symptoms. They're not treating the root cause. They're managing it. Now, those organs are still getting worse because the root cause in the leaky gut is still there. But now something else goes bad. Now the kidneys are going to go bad. Well, when the kidneys and the liver start to go bad, those are the filtration organs in the body. Now you get high blood pressure. Now you get high cholesterol. Now you get swelling in the feet and ankles. Now your body cannot metabolize protein like it's supposed to. And protein is the tissue that heals every cell in the body. Now your body doesn't have the fuel to heal. Now when the kidneys go, guess what goes after that? Heart does. Now when the heart goes, what do we die from? We have a heart attack. All because of the leaky gut. Now, the leaky gut and the abnormal gut bacteria has a genetic predisposition as well. Have you ever heard of a gene called MTHFR or MTRR? Or any of the methylation genes? If any of those genes aren't firing like they're supposed to, now your body can't get rid of toxins efficiently. And now your body can't handle B vitamins properly. And now it can't handle things like glyphosate, which is on all kinds of gluten. And those foods are going to destroy your GI tract. So you may have a genetic predisposition. How do you know that? You do a DNA discovery kit to find that out, and then you eat for your body type, your blood type, and your genetic code. This is about getting to the root cause of the problem, folks. So I think it's important that we also talk about another big thing that leads to leaky gut and bacterial issues. And that's taking long-term exposures of non-steroidal anti-inflammatories. You've heard people say it's as safe as a Tylenol, or just take an aspirin, you'll be fine. An aspirin a day keeps the doctor away. All of those, every single one of those non-steroidal anti-inflammatories on the market, every single one causes GI bleeds. Every single one of them causes some type of a GI bleed. So whenever you take an aspirin or a Tylenol or an Advil or all these other things, they're going to cause that intestinal tract to leak. I know people that have had to take a Tylenol or an aspirin or something to help them sleep for decades. I know a lot of people that have been told take an aspirin a day to thin your blood so that you don't have blood clots and heart attacks. That's one of the most ignorant things I've ever heard. If you want to take something to do that that's natural, take white willow bark. White willow bark is the original natural form of aspirin. Then when now Bayer Monsanto, the pharmaceutical company, when they grabbed white willow bark and patented it, they've turned it into an NSAID that causes GI bleeds. Just letting you know, that's what it is. Going back to what Hippocrates said, the father of all medicine said, all disease begins in the gut. All disease begins in the gut. What's disgusting to me is that all doctors don't begin with looking at the gut and looking at DNA. They're missing so much of the problem. So much of the problem. So let me give you some ways to test for leaky gut. There's a couple ways to do it. Number one, you can do a blood test. Remember this or write this down. There's a blood test called zonulin. If you measure a blood marker called zonulin and zonulin's positive, that's a positive indicator that you have leaky gut or gut bacterial issues. What's another test that you can do? You can do what's called a fecal sample, where we take a sample of your stool, we send it off to the lab, and we measure the RNA and DNA inside your fecal sample, and it tells us what kind of fungus is there, what kind of bacteria is in there, what kind of viruses are in there. I mean, it measures thousands and thousands of bacteria. There are tens of thousands of bacteria. There might even be more we don't even know about yet. So those are some simple tests. Another thing that you can do, and many of you have seen me talk about this, you can take a clear glass, and you can, first thing in the morning, you fill this glass up all the way to the top with water. And before you brush your teeth, before you eat anything, before you drink anything, before you do whatever, you spit saliva into the water, into the clear glass. And then you go about your business and you let it sit for 15 minutes. And then after 15 minutes, you come back and you look at where that spit is. Healthy spit that has healthy bacteria in it is going to float on the top. If your spit starts to sink to the bottom, or it streaks, or it sits at the bottom, that's a sign that you've got too much bad bacteria in your body. That's a problem. So those are some simple ways to know if you've got those issues, or you can simply do what we call elimination provocation type of a food plan. If you eat something and you feel sick from eating it, you probably have some type of leaky gut. If you eat something, you get bloatiness, gas, distension, it's probably there. So let's talk a little bit about, I'm going to give you 10 biohacks, and then I'm going to answer your questions. By the way, whatever questions you have, put them down in the Q&A at the bottom, not the chat, the Q&A, okay? So I'm going to give you 10 biohacks. So here we go. The first thing you can do is adopt what's called an anti-inflammatory food plan. Well, what is that? So remember when I told you about going to shop at the grocery store? Well, you got the outside of the grocery store where all the fresh produce is, the fresh meat, vegetables, you know, the eggs, the those kinds of foods. On the outside, that's what you eat. And then you avoid foods that are GMO and that have glyphosate on them. If you'll do that, number one, that'll help you. So avoid the foods that trigger problems, things like gluten, dairy, food dyes, so red dye, yellow dye, blue dye, those dyes, those colorings in there destroy the gut bacteria and poke holes in the gut lining. Also, a lot of times dairy is a problem for most people. And sometimes eggs can be a problem, but dairy typically is more of an issue. Just remember, cow's milk are for cows, humans' milk's for human. However, goat's milk, and I really like raw, organic goat milk. It's the closest thing that we can find to human milk. It's very beneficial. It's very, very healthy for the body, but all things in moderation when it comes to that. So that's number one. Number two, introduce probiotic-rich foods. These are foods like kefir, kimchi, sauerkraut. Man, I'm a huge fan of sauerkraut. Did you know that you can get more vitamin C from sauerkraut than you can from oranges, from grapefruits, all those things? So I try to eat a good big spoonful, big old spoonful or forkful of good, healthy, organic sauerkraut every day. Every day I try to do that. Fermented vegetables, and you can learn how to make your own fermented vegetables. It's very simple, very easy, very inexpensive. You can make them own in the convenience of your own home. Those are powerful things to do. Kombucha, kimchi, those kinds of foods are really good. So introducing fermented foods. And when people say, ew, I don't like those, that's the bacteria, the bad bacteria, probably candida, being an overgrowth. And by the way, candida is known as the great masker. It masks all kinds of other symptoms. It mimics all kinds of other disease or disease processes in the body. So when you don't crave good foods and you crave junk foods and sweets, that's the bacteria in your GI tract, overtaking the enteropathic nervous system, overtaking your taste buds. That's why the first couple days of a sugar elimination diet, which is step number 3, is avoiding sugars, because sugar feeds those bad bacteria. Now, we're going to have some form of sugar in our diet from, from our foods, from our, it's hard to avoid all of it. But man, did you know that the average American eats 150 pounds of sugar per year? Think about that, 150 pounds of sugar, and it sneaks into more than anything. You may say, I don't eat junk food. I don't eat bread, pasta, grains, dairies, oats, barley. I don't eat those things, which those are foods that can mess our GI tract up, but it's in a lot of juice. The juice you drink has a lot of sugar in it. The Gatorades, the sports drinks, the soda pops, that's where people are getting destroyed and they don't even know it. So we want to minimize those sugars. And then number 4, we want to increase prebiotics. This is where that 95% of the population statistics comes from. 95% of the population that eats a Western type diet or a standard American diet is not getting enough prebiotic. You see, everybody's heard of probiotics, but the prebiotic is fiber. It's the stuff that feeds the bacteria. See, these little bugs that are living, they're living organisms in and on our body, and we need them in and on our body. If they go away and we destroy them, man, that's not good. We've lost our shield of protection. And the prebiotics are fiber, and primarily vegetable fiber, but fiber nonetheless. And I'm not talking about like phylum husk and fiber supplements. I'm talking about garlic, onions, leeks, asparagus, bananas, certain kinds of whole oats, those kinds of real fruits and real vegetables. Feed that bacteria, because the prebiotics mix with the probiotics to make something called a postbiotic. And that postbiotic is a medium chain fatty acid, and things like eating ghee butter, things like eating extra virgin olive oil, having coconut oil or the extract from coconut oil, which is MCT oil, which, by the way, people say all the time, Dr. Eric, how's your skin look so good? Well, I appreciate that, but I take MCT oil, coconut oil, and I put it on my skin, my head, my arms, my belly every day. Why? Because my body, your body, can absorb those good fats through the skin. So here's another one. There's a supplement called L-glutamate. L-glutamate is an amino acid. L-glutamate is one of the amino acids that's in the peptide BPC157. That's why I'm such a big fan of peptides. All peptides are amino acids stuck together that tell the body to do something, that signal the cells to function. But L-glutamate is an amazing nutrient to help heal the gut. So if you've got leaky gut, you've got those symptoms we talked about, you got a positive spit test, start doing some L-glutamate. Here's another thing that you should do. Once you get over the age of 30, your body turns down big time the production of enzymes in our body. Enzymes like amylase break down carbohydrates, lipase breaks down fat, and protease breaks down protein. If you don't have stuff to break down fats, carbs, and proteins, you can't digest your food. If you can't digest your food proper, that's going to cause an inflammatory and an autoimmune response against every time you eat. So a good organic plant-based multi-enzyme is a true game changer. Every man, woman, and child, well, at least every man, woman over the age of 30 should be on it. And unfortunately, because of metabolic syndrome and insulin resistance and things we're seeing in children to this day, they should be on them as well. So those are some other things that you should be doing. Now, incorporating foods like bone broth. I'm a big fan of organic bone broth to heal the gut. When in doubt, bone broth. Bone broth and intermittent fasting, giving that gut a little bit of time to heal, can be an absolute game changer as well. Think about if your ankle was sprained. Well, if you're running around on a sprained ankle, that's going to cause that ankle to not heal as quickly as it should. Well, if you have leaky gut syndrome or inflammatory bowel issues, you eating a lot of hard, coarse, rough foods is going to upset that. Bone broth, because bone broth is nutrient dense, it has a ton of collagen, has gelatin, and a tremendous amount of amino acids. And those amino acids, when they get in the body, turn into peptides. Amino acids turn into peptides. and that helps heal the body. So I'm a huge fan, and I mean a huge fan of bone broth. Here's another one: managing your stress. Knowing that most of the things that you worry about are not things that you can control anyway. You guys remember that old song where the line in the song was, you know, worrying about most things is kind of like trying to solve a algebra equation by chewing bubble gum. It's completely not related, because worrying about things doesn't make the problem any better. All it does is make the problem worse. And most of the things that we've stressed out about and worried about in our lifetime that we thought were going to knock us out, kill us, or destroy us, they weren't even a thing that even happened. So just anything you can do to help improve mindfulness, deep breathing exercise, meditation, all those kind of things are so powerful, because it reduces that cortisol level. That's a empowering thing. Here's another one: make sure you're getting adequate sleep. If you're not getting at least 8 hours of sleep a day, and I know some of you are like, what are you talking about, Dr. 8 hours of sleep? That's crazy. Well, I used to be one of those guys that bragged about I'll sleep when I'm dead. Well, you know what? I was just going to be dead sooner. I cannot impress upon you the power of sleeping in a cold, dark room with no noise, no light, and you just sleeping and breathing. And by the way, I'm a big fan of mouth taping when you sleep, because most people, they don't breathe out of their nose proper, and ionizing through your nose is what stimulates your brain and stimulates your parasympathetic so that your body can heal, which stimulates your vagus nerve, which heals your gut when you're sleeping. So if you're a snorer, learn how to start doing mouth taping. That's a whole different ball game, but man, that sleep will massively help you. Here's another one: regular activity and exercise. Folks, we are creatures of movement. If we don't move it, we lose it. Yes, exercise, going for a walk, those kinds of things can help you improve your GI function. Did you know that going for a walk, just a 10 to 15-minute walk after you eat a meal, can reduce your blood sugar by 30 points? That's huge right there. You know, longevity experts tell us that the key to longevity and to anti-aging and to keeping our cells healthy is truly keeping our insulin under control. So keeping active and sleeping, powerful, powerful tools. The muscles in the body are the organs that pull in the most glucose. So it helps us keep our sugars under control, which keeps our gut from getting those holes poked in it. And it keeps the sugar is what feeds those bad bugs. And then limiting certain things, limiting alcohol. Listen, all things in moderation, even moderation, limiting alcohol and limiting non-steroidal anti-inflammatories. If you can limit those things or get them out of your system completely, you're going to set yourself up for more success than failure. And then eating a good probiotic, having a probiotic that's a spore-based bacteria. There's a formula that we created called Master Microbiotics. I know a lot of you have started using it and trying it. You're getting great results with it. You've got to have a spore-based bacteria that has multiple bacteria that can get into the small intestine and that can repopulate. We need to be doing this all the time. I'm telling you, having a probiotic, a good one, is more important than having a multivitamin, multi-mineral every day. That is a big statement, but it's absolutely unequivocally true. So if you'll put those things into work, then you have an opportunity to help get to the root cause of the problem. But just like all things, don't guess, test, run your genetic profile, get some blood work done, do a stool sample test, find out where you're at, because if you want to get somewhere, the only way that you can get to where you want to go is you got to first know where you're at. It's all about looking at the map, right? If I want to go from St. Louis to California, I need to know where California is, but I also need to know where St. Louis is so I can map my route out along the way. So, okay, I know that's me chatting for 30 minutes or longer, so I apologize for that. Give me a thumbs up if you guys learned something and enjoyed that so far. So far, so good? Good stuff? Awesome. Good, good, good. Okay, so now here's what I want you to do. If you have questions, I'm going to spend the next 15 minutes going over some of these questions that we've got, all right? So let's see here. If you have questions, put them in the chat, all right? Put them in the chat. So the first question, someone says, hey, is there any help with your products or procedures for ALS? All right, now listen. ALS is Lou Gehrig's disease. You know that there's, just if you don't know, I'm telling you, there's no known underlying true cause of ALS. ALS is a combination of a bunch of symptoms together, but we do know several things. We do know that there's a genetic predisposition. So knowing your genetics is super important. Number two, we know that there's an inflammatory part of it. If you have chronic inflammation, that's going to be a problem. We know that there's a gut microbiome component because the bacteria in the gut make the neurotransmitters tell the brain what to do. The bacteria in the gut allow the foods we eat to be absorbed so our brain can work. So we know that there are those components to it. We know that there's no one thing. There's no like, take this Vita Vita Vegemin to fix this problem. By the way, you're going to hear me say this a lot. It's not about the products, it's about the process. But the process helps you find out who you are, how your body works, and what you should do to improve it. I'm going to tell you this right now. I don't care if you have ALS, if you have heart disease, you have cancer, diabetes, stroke, or if you want to prevent problems. It's not about treating the symptoms or the disease. It's about treating the cellular dysfunction, the genetic dysfunction, the microbiome dysfunction, and the nervous system deficiencies. Fixing those will help. So make sure you're working on all those. I will tell you, 22 years of practice, especially dealing with functional neurology. I've seen a lot of ALS patients. And I will tell you that getting minerals in their diet, getting their gut bacteria balanced, reducing their inflammation, making sure that they're getting a lot of protein, because ALS is also a protein degradation issue. So having a lot of excess protein in the diet and having protease, the multi-enzyme, very powerful things to do. That's very important to do. So here's the deal too. As we get older, we don't absorb protein. Protein is the nutrient that heals all the tissues in our body, including our white blood cells, red blood cells, nerve tissues, you name it. So how much protein should you have? So figure out your lean body mass, how much lean body mass you are, okay? And that's how many grams of protein you should have per day. So for example, another way to do it, you could take your body weight in pounds and then find your ideal body weight. So, your ideal body weight might be 150 and you might be 200 pounds. So you need 150 grams a day of protein. I promise you, most of you are not getting enough protein. So please, hopefully that helps with that answer. That's a great question, by the way. Let's see. Hey, Dr. Eric, I've taken antifungal treatments, which helped lots of my reflux. Good. However, I'm anxious. There's probably still bacteria issues. My stomach churns. And I'll vomit, saliva, Okay, so there's a couple things that could be going on there. Number one, you probably don't have enough enzymes in the body. So let me help you with a routine. If I was you, this is what I would do. I'm a doctor, not your doctor. Consult your doctor. But if you want to listen to one, listen to what I got to say. I would go get some apple cider vinegar, some organic apple cider vinegar. I would do at least the big tablespoon of that first thing in the morning. In the evening time, I would get some organic baking soda. I would take a teaspoon of that or half to a full teaspoon, put it in water, squeeze a lemon, drink that down at night. With every meal that I eat, I would take 2 digestive enzymes. I would take my probiotics at bedtime. I typically take my probiotics at bed. You can get them anytime you want, but I take mine at bedtime. And if that doesn't help, by the way, I would also try to find out what foods are triggers to me. And if you don't do a blood test or a stool sample to find out, you can do what's called an elimination provocation diet, which means, so you take a food that you think might be a problem. So let's say I think milk might be an issue. I'm going to avoid milk for 7 days. No milk 7 days. Day 7, 8, 9, I'm going to drink more milk than I normally do. And I want to see how I feel day 9, 10, 11, and 12. And if I don't have any problems, that's a good food for me. But if it causes issues, that's a bad food for me. So I would do those things. I would make sure that I chew my food like excessively, like 20 times per bite before I swallow. And then I would not drink a lot of fluids with my meal. When you drink fluids, it reduces the stomach acid. We need stomach acid to help our body break down and digest food. So I drink a lot of fluids throughout the day, just not when I eat my meals. Try that. If that doesn't help within 6 weeks, then let us know and we'll do some more stuff. Okay. Okay. Let's see. Robin says, I understand antibiotics are bad. When flu and cold infection is bad and drags on for weeks. Okay. So here's what I'll tell you. Oh boy. If flus and colds, if they're viruses, an antibiotic's not going to help you. An antibiotic is just for a bacteria. So if you are going to get an antibiotic, you first need to know that you have a bacterial infection. By the way, I'm sure you've probably seen the studies and research that shows that oregano oil and garlic have actually shown to be more beneficial than most antibiotics on the market. There are a lot of natural antibiotics that are out there, but it's really about boosting the immune system. You know, eat well, think well, move well, breathe well, and you'll be well. So look, if you have to have an antibiotic, and when I was younger, I had some. My parents didn't know any different, and but my children have never had any. They've never had to have any. And since I've been a physician 22 years, I haven't had to have any, neither my wife. Okay. But we have IV vitamin C therapy, we have silver, we have, enzymes. We know how to manage these things naturally. And it's not difficult, but you got to have someone in your corner that can help you. That's why having a biolimitless center of excellence in your neck of the woods is going to be so powerful, because now you'll have a place to go where not only you can get the care you need, but we're going to be a major educator in the community, hosting monthly and probably bi-monthly events twice a month where you can come into our facilities and we'll teach you what health really is. So I understand what you're saying, but you gotta find the root cause of why you're having it. Someone says, will taking master microbiotics interfere with SSRI meds? No. So the master microbiotic does not interfere with any drug that's on the market. Doesn't interfere with any of it. Neither does the cell signaling formula, neither does the biolimitless daily, neither does the detox formula. Our core 4 products have no contraindications for any medications. No problems whatsoever. Let's see. A couple more questions. Can leaky gut be a factor in AFib and sleep apnea? 100%. Okay. I'll tell you this as well. There's 2 things that I find more prevalent in AFib, and that's a magnesium deficiency and a vitamin C deficiency. So my patients that have AFib, I draw blood tests on them to see their levels of it. Then what we do is we recommend magnesium, and here's the dosaging for magnesium. You take your body weight, you take that number times 10.6 and divide that by 2.5. That's how many milligrams of magnesium glycinate you should be taking every day. Do that, number 1. Number 2, now go and get yourself some vitamin C, some liposomal vitamin C, or start taking some CMOS, right? That has a lot of the 92 essential nutrients and minerals that the body needs every day. Usually liposomal vitamin C, 3,000 milligrams twice a day, is a really good place to start to help with AFib. But if you have sleep apnea, a lot of times it could be because the gut's off. It could be because your nose is plugged because there's fungus and bacteria in there, or it could be because you're a mouth breather, not a nose breather. There's a lot of things that are out there. And yes, this is being recorded. I'll record. This will be on biolimitless.com is the website. You can find all the research and data and everything on biolimitless.com. Someone says, hey, I have dry eye syndrome. Okay. That's an interesting one because that could be caused by multiple things. Number 1, there literally could be physical damage to the nerves in the upper part of your neck. The nerves in the neck control the eyes and the ability for the eyes to produce the fluid, right? And so if the upper neck is problematic, that can cause the eye issues. Number 2, there could be some stress either on the liver or the gallbladder. Liver gallbladder can cause issues with the eyes as well. And there could be an issue with minerals. So I would check all of those as well. And I'm a big fan of using the natural tears or using some silver drops in the eyes regularly to keep them lubricated. Good question. All right. Someone says, what kind of tape do I recommend? You have a mustache and a beard. Get some duct tape, brother. I use, it's like a K-tape and it's breathable. So it just keeps your mouth closed. It's more of like a neurofeedback type of a thing than this. Okay. Mouth taping is huge. I just did a pep talk podcast on that. Howard, good to see you, brother. I'm proud of you. You're doing really well. A couple more. Okay. A couple more questions I'll answer. Someone said my gut can stop can gut stop arm and hand tremors? All right. Probably not. It could be the same. Let me explain how it could be. So listen, this is very important. You have to understand how everything is connected. So did you know that the way the body works is the brain lives in the skull. It sends signals down the spinal cord and out these 32 vertebrae in our back. Well, the nerves that come out of C5 and C6 in the neck, C5 and C6, those nerves control the arms, hands, and fingers. And those nerves also control the stomach and they control the liver. So if there's a problem with that nerve, it could cause those issues in the organs. And sometimes if there's a problem in the organ, you can have a negative feedback loop to where it causes that to happen. So there could be a correlation. It's probably not the cause. We got to find out why you're having those tremors. Okay. A lot of times that's a brain demyelinization issue, or it's a loss of a neurotransmitter from the gut, or not enough proteins, or not enough minerals. Up your protein, start getting about 5 to 8 grams a day of organic sea salt in your diet. And let's see if that helps as well. Okay. Let's see. A couple more questions. Almost done. Sorry, guys. Says, I mentioned Crohn's. In your experience, has fixing the microbiome helped with Crohn's? Yes. Listen, let me tell you the cascade. Someone has a genetic imbalance called MTHFR, MTRR, BDR, one of the methylation genes. If that's bad, and they eat gluten and they eat foods that jack up their gut, now the bacteria is off. Well, now the bacteria is off because they eat the standard American diet, have stress, and have deficiencies in their body, right? So now that's a little bit of inflammation over a long period of time that then leads to inflammatory bowel syndrome, which then can cause Crohn's. So this whole cascade leads back to genetics and gut, genetics and gut, genetics and gut. If you know your DNA, you eat for your genetic lifestyle, and you get your gut microbiome balanced, you're stacking the deck in your favor. That's so powerful. Is there a correlation between MS and gut health? Absolutely there is, because of the neurotransmitter connection. Remember, 90% of your vagus nerve, if you go look up vagus nerve or polyvagal theory, you'll find that the vagus nerve is like a part of everything. In fact, Cover of Scientific America, I think it was March or May 2014, 15, or 16, one of those years, it said electrical cures. You could probably Google it, electrical cures, and it'll say Scientific America magazine. And they talked about how if we could stimulate the vagus nerve, we could help Parkinson's, dementia, MS, type 1 and type 2 diabetes, obesity, all kinds of things. Well, man, if 90% of that vagus nerve is in the GI tract, it just makes common sense to be able to do those things. All right. So yes, there is a correlation, not causation, but correlation. Okay, perfect. Kidney failure. Is there a way for dialysis patients to return to health? So listen, matter has limitation, even matter. I'm going to tell you that I have a lot of experience with kidney disease. My mother was a kidney dialysis patient. We got her healthy enough that she was able to get a kidney transplant. But my mother, unfortunately, because she has MTHFR, which I have as well, because she wasn't educated on what she should eat, because her doctors didn't know what to do, they over medicated her, they killed her liver, which then caused cancer. Because if the liver's not good, you have a risk of cancer. And then it killed her kidneys, and she was so sick, she couldn't repair it on her own. So remember, the cause is the cure. The cause of a problem is the cure for the problem. All right. The cause of the problem is the cure for the problem. All right. So we got to go and focus on being healthy, not just treating the symptoms. All right. Someone said, I had a pretty bad reaction to baking soda dissolved in water, took about 1/8 of a teaspoon. What's the probable cause of that? Usually, if you have that, it's H. pylori, which is a bacterial infection in the stomach. So H. pylori is a bacteria that grows in the stomach whenever we have low stomach acid. Most heartburn, reflux, and indigestion people have, it's not too much acid, it's low acid. It's called hypochlorhydria. In fact, I think it's 87%, but I know it's above 80% of all reflux and GERD is because of low stomach acid. Low stomach acid means you eat something, you don't have enough acid to digest it, your stomach is too alkaline already, and so the food sits there, it ferments, and you spit it up. Baking soda makes that more alkaline. That's no good. Apple cider vinegar helps with it. If you take apple cider vinegar, you throw up immediately, that's a sign of some serious issues in the stomach. If you take if you take baking soda and you have those problems, take a little bit of apple cider vinegar and see if that clears it up. That a lot of times can help. Or you could have what's called a hiatal hernia, which is a structural issue, because when most people eat, they're slouched over like this, and their stomach can literally jam up into their rib cage. So that could very well be a part of the issue. Part of the issue. Let me answer one or two more of these, and then we're going to get going here. Is GI motility disorder from leaky gut? GI motility disorder, what that means, just so you know, is when you eat something, things move too slow through the GI tract or they move too fast. I mean, people eat something and 2 hours later or an hour later, they have explosive diarrhea. That's too fast. That's the body trying to get it out. There are a lot of things that cause GI motility disorders. Normally, it's a problem with the nerves in that area or the muscles. So the vagus nerve could be the problem. It could very well be the bacteria being out of whack. But what we found, and we're seeing this now more than ever, because some people are overdosing with injections like Ozempic and trizepatide and Wegovy and things of that nature. They're taking too much of that. There's a lot of things that could cause that. It's hard to really tell just by, you know, just by hearing your question on the internet. Okay, another question. There's about 7 different types of magnesium. Is there a good one for what are you taking for? All right, magnesium glycinate is the most absorbable, easiest magnesium. It will raise your blood levels of magnesium, which is what you want. Yes, there's magnesium threonate that can help with the brain a little bit differently. Yes, there's magnesium citrate that can keep your bowels moving if you're constipated. There's all kinds of different magnesiums, but magnesium glycinate is what I've used for 20 years. I've played with all of them. They work really, really well. And by the way, if your body's toxic, you got to stay off magnesium while you're detoxifying the body. There's a lot of reasons why you should or should not be on magnesium. I'm a big fan of it. I think most people should be on it. All right. Let's see. Let me add one more and then we got to go. What do you suggest for diverticulitis? Diverticulitis is inflammation in the intestinal tract. First and foremost, we got to get the inflammation down. So stop eating food for 3 or 4 days and go on a liquid diet till the inflammation calms down. Okay. Go on a liquid diet, bone broth. So beef bone broth, chicken bone broth, eating bone marrow. You can juice up some celery in the morning. Make sure you're using a lot of salt and good salt. So organic sea salt, which I like Baja Gold salt, or I like Celtic gray salt. Those are 2 of the easiest and best ones out there. And then doing that, and then butter as well. Good real butter is a good thing to and let that calm down for a couple of days, and then fix the gut. Everything I told you, diverticulitis is a sign of leaky gut syndrome. It's an acute flare-up of a chronic leaky gut. So that's what you got. All right, folks, it's 7:01. Give me a thumbs up if you enjoyed this. How many of you know people that probably should have been on this call tonight? Yeah? Awesome. Good. Look, I hope you guys love this. I appreciate you all. I love doing these things. This is so much fun for me. This is what I love. Doctor is Latin for teacher. My job is to teach, reach, inspire, and motivate as many people on this planet as we can towards happiness, health, and ultimately wealth. And I want you to help me help other people do that. So plug in, go to our website. We're going to have all this stuff on biolimitless.com. That's biolimitless.com. You can scroll down under the resources and under all the categories we have down there to find all kinds of things from a health and wellness standpoint. So guys, until we meet again, I'm Dr. Eric Naputi. God bless you. God bless America, and God bless the world. Stay smart out there, and I'll see you soon. Bye, everybody. Have a great day.